Good morning to all. Today is a chapter seen about the therapeutic communication and interpersonal relationship. Myself, Sathya, nursing tutor, ES College of Nursing, Villupuram. What is a therapeutic communication? Is a therapeutic communication means is one person to the another person. You have to get the information regarding those person. What the interpersonal relationship maintain the nurse and patient in this hospital. What is a very much you got to utilize from the therapeutic communication and the interpersonal relationship between the patient and nurse is the most important topic about the therapeutic communications. Next, move on to the introduction of communication. Is a communication is a word is derived from the Latin communicare, meaning to share. To share means idea or any thought. You have to share about the few words to the person or patient. It is imparting or exchanging of information by speaking, writing or using some other medium. You have to information regarding any written work or any speaking. Then you have to give the some idea through the person. This is the meaning of communication. Then definition of communication. Communication is a process by which information is exchanged between individuals through a common system of symbols, signs and behavior. It's the most important topic about the communication as a process. It's a lifelong is a process by which information is exchanged between the individuals or through the common systems. Next, move on to the communication process. Already seen about the sender, message, channel, receiver and feedback. Sender means those who having sender means you got written or oral. You got to send the message. Sender message you got to write it or written work or oral. You got to message what the sum exactly you got to written about the messages. Channel you got to give the through the information through the channel, any audio or video or visual aids. They got to give the information. Receiver means those who got to received the messages, received the some informations about the what you have the center. Then you got to give the feedback about the receiver. This is the communication process. Let's move on to the goal of therapeutic communication. You got to when you are working in the field of nursing area, you got to give the established therapeutic nurse-patient relation. Is the most important aspects of you got to give the exact therapeutic nurse-patient relationship. Why means you got to identify the exact patients what we need, then what we care, what we going to give the medication aspects, what you got the exact helping want needed for the patient. How to give the therapeutic nurse-patient relationship is most important about the patient. While you handling the patient means you got to give the exact therapeutic nurse-patient relationship. Then identify the most important patient needs. Needs means if somebody want to care about the patient, is the nurse is give the care to the patient. Is the most important patient want needs the care to the trusted to the nurse. Assess the patient perception of the problem. You have to identify the exact problem of the patient. You have to identify exact what you have to give the care to the patient. Then facilitate the patient expression of emotion. You have to identify the emotional body languages or anything for the what exact need of the patient. Then how to give the care to the according to the needs. You have to do clarity about the communication. Then implement intervention and design to address the patient needs. You got to identify the intervention about the what you got to give the care to exact patient. You got to give the communications. You got to maintain the communication is a therapeutic communications. Then principles of or characteristics of therapeutic communication. The patient should be primary focus interactions. Those you have to interaction about the nurses and patient. Then professional attitude sets the tone of therapeutic relationship. You got to professional maintain the attitude sense. You got to tone. You got to how to give the clarity about the information regarding to the patient. Use self-disclosure and casually one when it has the therapeutic purpose. Then you have to self-disclosure. This self-disclosure means you have to give the is a therapeutic purpose. You have to self-trust. You have to give the care to the patient. Avoid social relationship with the patient. You have to avoid the social relationship. Why means you have to know interaction between those persons. Maintain patient confidentiality. You have to maintain the secret about the what care to the given, what care to the another patient. You have to maintain secret between those patient. You have to maintain the in confidentiality. Then assess the patient's intellectual competence and determine the level of understanding. What we exactly to understand about the patient, what we have to understand about the nurse. Both the peoples can be understand what we needed to the care. The patient want need care, the nurse is give the care. So what you have to maintain the intellectual competence and determine the level of understanding. Then implement intervention from the theoretic base. You have to give the exact nursing process. They have to intervention about the give the maximum care to the patient. Maintain non-judgmental attitude. Non-judgmental means I am there. I got to give the care. You got to myself. You got to improve your care. So don't give the bad judgment to the patient. Avoid making judgment, poor judgment about the patient behavior. Avoid giving advice. Not is a bad advice. You have to not give the negative advice to the patient. Guide the patient to interpret his or her experience rationally. You have to give the exact what you have to done the care. So not give the bad care to the patient or guide the patient interpret or his or her experience rationally. Is the recordings. Let's move on to the therapeutic communication techniques. Listening. Those who are to listening to the communications, you get the ideas from those peoples. You got to proper listening to the communications. The next one is a broad opening. Broad opening in nothing but is a non-specific statement or question that encourages the other person to initiate the conversations of share their thoughts and feelings. Then restating means you got to restart again to the communications, either asking any doubts and questions about the communicators. Then clarification the doubt. You got to clarify about those who are asking for questions and doubts regarding to the communication. You got to clarify and exact to the communications. Then move on to the reflection. Then reflect to the either actions about the body languages as speaking or doubt regarding the communications. Then humor. Humor is nothing but the funny you got to raising the any laughing therapies or qualities of the somebody in some things. Next, seventh is the information. You got to sharing about the few ideas about the patient. You got to exact what you have to say about the patient informations. Either you got to give care or any tablet or any health education. You got to give the information through the patient. Then focusing. You got to once you got to focusing the patient. You got to was care given to the patient. Then what the exact physical activity, eye movement, then the body languages, what we need exactly you got to focusing, then only you got to give the care to the patient. Then sharing perceptions. You got to share about the perception regarding anything in the information about the communication. Then theme identification. What we exactly got to give this is the identification about the communication. Then silence. You got to maintain the silence between in those situations. Then suggesting. You got to give the any idea or anything in the new. You got to give the suggestion to the patient as well as nurse. Listening. First move on to the listening. It is an active process of receiving information. The response on the part of the nurse is the most important. Is the nurse is how to get the information receiving the patient. They maintaining the eye to eye contact, nodding, gesturing, other form of receptive non-verbal communication conveyed to the patient that he is being listened to and understood about the patient. You got to listening carefully to the give the care. You got to properly listening. For example, I will say infusions or injection loading or any drug calculations. You got to clearly you got to listening to the patient. It's the most important aspects of the while doing the procedures. So listening. Listening means is the receiving information. Then broad opening. They encouraging the patient to select topics for the discussions. So example is either health education about the diet or explain, take notes and ask doubt. PowerPoint explain about the therapeutic communication technique. You got to broad opening about the while you are talking. You got to get the tone, vocal tone. You got to exactly you got clarity about the voice. Then restarting. Repeating the main thought expressed by the patient. How restart the questions. You got to asking somebody is asking for the patient repeatedly asking anything questions regarding any doubt, cat what disease condition about the doubt. You got to solve the problem about the patient. Next, clarification. So attempting to put vague ideas, the nuclear thoughts about the patient into words to enhance the nurses to understanding, asking the patient to explain what he means. That he have to clarification about the doubt regarding the patient. Then exactly you have to understand about the communication. What to clarify about the doubt, any give share about the ideas, or you have to give the words. You have to give the nurses can understanding the asking the patient what he need the care. How to give the exact care to the patient. That only you have to give the care. Reflection. Directing back the patient's ideas, feeling, questions and content. Reflection means against forward. You have to direct back the patient ideas, feelings or questions and content. You have to give the anything, questions, patterns or feelings. You have to share about the patient. Then humor. The discourage of energy through the comic enjoyment of the imperfect. Example is the funny or amusing qualities somebody says something. Information. Give the information regarding what we exactly have to observe from those person. So nurse can give the information regarding the patient means what they exactly gain the knowledge about the nurse we will say it about the patient. Okay, because they get the information about the communication. Next, focusing. While focusing the patient, you have to exactly go to statement that help the patient expand on a topic of importance. Any surgical site, any you got to catheterizations or anything is the IV fluid in centralization about the patients or IV line or anything. You got to focusing about the important aspects of the statement. Then sharing perception. Sharing perception, asking the patient to verify the nurses to understanding of what the patient thinking or feeling. You have to sharing perception. You have to share something about the feelings about the patient. You have to give the good care to the patient. Next, theme identification. This involving identification underlying issues or problems experienced by the patient that emerged repeatedly during the course of the nurse-patient relationship. Theme identification, you have to exactly to solve the problems or issues or problems you have to experienced by the patient that emerged repeatedly during the course. Silence. Lack of verbal communication for a therapeutic reason. Because of while doing procedure, you have to maintain the silence about the patient care. Then suggesting. Presentations alternative ideas for the patient consideration relative to problem solving. You got to give the some solution between the problems. Exactly anything is monitors, devices or patient care, anything about the hospitalization, you have to give some ideas for the emergency critical situation, give the share about the some ideas. So you got to solve the immediate problems when we need, got to solve the problem. Then let's move on to the non-therapeutic communication. Previously is a got to therapeutic communications, you got will see about that. Today now move on to the non-therapeutic techniques. Reassuring, rejecting, giving approval, advising, defending, requesting. Reassuring means don't give the false perception. Reassuring, you got to don't give the reassuring to the patient. Rejecting, don't reject it to the some patient or anything, to don't reject it from the any care to the patient. You have to give the all care to the patient. Then giving approval. Approval means don't give the false negative to the communications. Then advising, don't advise from the you have to good health, you have having, you have to improve your quality of care. You don't to give the bad advising from the patient. Then defending means you have to sharing the in mind thought, you have don't sharing from the apart from the social aspects. Then requesting, to don't request from the care, give about the nurse. Then belittling the feeling of the patient, this non-therapeutic techniques should be avoided. Here don't touch is bad touching to the patient. You have to avoid it, the patient neglecting it. You have to give the care, continuity of care to the good touch manner. Then communication failures. How to communicate failure? Failure to perceive the patient as human being. You have to the patient as human being means is anything somebody can failure to communicate to the perceiveness. Failure to recognize the level of meaning in communication. How to recognize about the communication, level of meaning of communication? Failure to listening, eye to eye contact, and failure to interpret with knowledge, use of close-ended question only. These are the failure of communication is a poor languages, poor technical issues or any poor adequation of the languages. These are the communication failures. Then conflicting verbal and non-verbal communications, giving false reassurance, then changing subject is not comfortable. These are the failure of communications. Still now we will discuss about the therapeutic communication in the nurse-patient interpersonal relationship between the patient. Then meaning of introduction, definition of introduction, then types of introduction, then how to maintain the nurse-patient relationship. Thank you.